Hello everyone, it's good to see you all again. So today I wanted to have us take a look, a little more in-depth look at continuous glucose monitoring, or CGM for short. So CGM has really improved the lives of people with diabetes since they first came out, and quite frankly the technology just keeps getting better all the time. So one of the things I wanted to talk about is the big difference between a finger stick, where you're checking your blood sugar, and continuous glucose monitoring. So continuous glucose monitoring isn't actually reading the sugar levels in your blood. It's reading the sugar levels in your interstitial fluid. So if you take a look at this slide, you can see that interstitial fluid is the fluid that's in between the cells and tissues of our bodies. So the difference is that sugar comes out of your bloodstream and it goes up into that interstitial fluid. So, and it's going to be a little bit different if you were to check a finger stick right at the same time as you looked at a continuous glucose monitor sensor. You're going to get a slightly different reading, but the technology is very accurate and it's so helpful. And one of the things that is most helpful for is that you finally get to see your blood sugar or your glucose levels anytime that you want. Continuous glucose monitor sensors are worn for either 10 or 14 days, and it just depends on what brand you have. They're waterproof, so you wear them in the shower, you wear them in the tub, you can go swimming with them. So they stay on the whole time. So whenever you want to see your glucose levels, you can. And so now you say, well, what does that mean for me? The great thing is that you're finally able to see in real time how your daily life and activities affect your glucose levels. What does the kind of food you're eating affect your glucose levels? Are you having a lot of stress? Are you sleeping well? Your physical activity. There's so many things that affect your blood glucose levels or your interstitial glucose levels, and now you're finally able to get to see them 24 hours a day. So you're able to see what happens to your glucose readings overnight. Are you going low overnight and you don't know about it? These are things that you'll be able to see now and talk to your healthcare provider about. And the greatest thing about that is this really gives you the control. So you have that knowledge and you have the confidence to make good, healthy changes so that your glucose is well managed, your diabetes is at your target range, and helps reduce those risks of complications. So with all of that new information, really gives the power back to you. And as you all know, we've talked about it before, but living with type 2 diabetes, it's a lot of work every single day. And by not having to do finger sticks several times a day, trying to figure out what your medications are doing or what your foods are doing, really takes a lot of the work out of it for you so that you can just have a nice smooth day. So if you want to talk about continuous glucose monitoring, talk to your healthcare provider. You can always sample a lot and see if it's going to work for you. You don't have to make a lifelong commitment to it right away. And you want to talk about the different kinds of brands, because some brands can only be worn on the back of the upper arm, and not a lot of people are comfortable with maybe having somebody see their technology. There's another brand that can be worn on the back of the arm or on the belly, and that might be the way to go for some people. So it's something that you want to do a little research into, talk to your healthcare provider about. But I do highly encourage everybody with type 2 diabetes to look into this because it's a real game changer for you. So with all that being said, we're about running out of time, so I'll see you next time. Bye.